I want to share with you 5 master points in the ear that can silence your tinnitus. That's right. Tinnitus is that type of wishing, buzzing, humming, hissing sounds that you may be hearing. And unfortunately, when you go to the doctors, they usually can never figure out why. Tinnitus can be quite complex. It can come from the external ear, it can come from the eustachian tubes behind the nasal area, it can come from the inner ear, the inner ear cells that communicate through the auditory nerve, through the auditory cortex in our brain. But the bottom line is, you just want to get rid of those symptoms. It doesn't matter what you call it, you just want to feel calm again. You want to feel good. And I want you to realize something. The big problem with tinnitus is that sympathetic nervous system. It causes us to become anxious. It affects our mind, our thinking, our sleep. This is not a good thing that people have to experience. I'm a past sufferer. I know what it's like. That's why I'm here trying to help you. So let's go for the nuts and bolts. These points that I'm going to show you are all in the ear. I'm going to locate them and tell you exactly what you need to do and start doing them. You can pick a couple of them that's going to be more effective than others. You can do all of them. If those who suffer tinnitus in one side utilize that ear first, that may be all you need. If you have tinnitus in both sides, you can try one ear first, but it's best to do both sides. So let me first explain to you our first point. And this first point is one of my favorite points, because what this point does, it kicks up your parasympathetic nervous system. It starts to wind you down so you can rest, you can get to sleep. And one of the most important things about tinnitus is you getting sleep. Without sleep, tinnitus gets worse. So the first thing I want you to do is I want you to locate the point. If you take your finger behind the ear, you come down to that part of the skull. This is called the mastoid process. It's a little round bone. So if you go behind the ear a little bit lower, you feel that round bone. But behind that round bone, right here, there's a hollow area. I want you to take your thumb in that hollow area behind the bone, not on the bone, behind that thick bone. Let me show you right here behind the bone, and put your thumb in there. And I want you to go around in clockwise circles 100 to 200 times. But do this anytime. But I challenge all of you to do this before you go to bed. One of the greatest natural sleeping points that will start to wind your brain and body down, and you'll feel it behind your eyes, behind your nasal area. You'll feel something start to wind you down, but this kind of paralyzes that communication network between that brain that you're feeling or hearing, that tinnitus, because tinnitus is something you cannot locate, but it's something that you hear. You hear it, other people don't. So 100 to 200 times you'll do this. I like to do both of them at the same time, because it's just doubling up, killing two sides with one stone, as we say, 2 birds with 1 stone, just getting in there 100 to 200 circles. Our first point, that can do wonderful things for you. And the second point, I want you to open up your jaw, and right behind the ear, as you open up the jaw, you'll feel the area behind the TMJ called the temporal mandibular joint, the mandible, and which is the temporal mandibular joint sitting right above it. But when you feel that bone behind the ear here, and you open the jaw up, right inside that open joint, because when you open the jaw, you put your finger, index finger in there, and it's hollow. Don't push too hard because it's tender. That's a master point. So you don't have to open your mouth when you do this point, but I want to make sure you're right in that groove, in that depression. As I go below that earlobe, behind it, as you open the jaw, you'll feel it, and it's hollow in there. Now don't push too hard because it's sensitive, but I want you to get in there and hold that point anywhere from 30 seconds up to a minute and a half, and just hold that point. This third point is the tragus. The tragus is that little flappy flesh right there on the outside of the ear as you look into the ear canal. Right in the front of that ear is a tragus. I want you to take your finger, index finger, and you're going to push that tragus into the ear canal right there. And as you do so, you're gonna sound like you're gonna not hear everything because it's gonna sound fuzzy because you're closing the ear canal. But as you hold that point, I want you to stimulate it. Just hold it. You don't have to go in little circles. Hold that again anywhere up to 30 seconds to a minute and a half. And you could also take that tragus and pinch it just like this and hold it there anywhere from 30 seconds to a minute and a half and just pinch it. And our fourth point is called sensorial. This is a common area where acupuncture is given all the time, just on the bottom of the earlobe. What I love about this is you take your thumb and your second finger, and I want you just to pinch it and massage it and stimulate that, and do that anywhere from 30 seconds to a minute and a half. And just stimulate that. Remember, if you can, do both sides. It can always be that much more impactful for you, but just stimulate the lobe. Very easy to find. Put your whole finger, index, as well as your thumb behind it, and just stimulate those points. This is a miraculous point. It can do wonderful things, but you'll notice certain points will work much faster. And when you find out those that work best for you, you'll stay on it and do it as often as you need to. And the final point is grabbing your ears right in the middle part on the outside lobes. Right here. Right here. And as you grab that point, I want you to pull the ears outwards. And as you pull the ears outwards, we're trying to open up the eustachian tubes, but to open up the eustachian tubes, which are the tubes that go behind the nasal area to the middle ear, I want you to open your mouth like ah, and close it as you pull. Ah, and close it as you pull. And you'll keep doing this anywhere up to a minute as well. Close as you pull. Keep it pulled, tugging apart. And you'll notice if you have sinuses, that commonly can cause tinnitus. It affects the pressure of those eustachian tubes. But while we do this, and as you open the mouth and close it, you're opening the eustachian tubes, and if you have fluid in there, that fluid will start to drain. If you have sinus issues, colds, flus, infections in the past, they can be clogged, causing that tinnitus, that high-pitched sound, that swishing sound, that buzzing sound. It could be any one of those. So you have a little simple job, but the job is easy. Why? It's safe. It's effective. Utilize these tools. I promise you, you're definitely going to find some of these techniques, some of these points. It's going to be very helpful for you. But there's a few things I need you to do. You must start omitting and diminishing those processed refined sugars. Remember, everyone has weaknesses in our body, and those sugars cause inflammation. Stress causes inflammation. It increases cortisol. You must be getting your sleep. Hydrate. Start exercising. If it's not going to the gym, start walking. Get those endorphins, those enkephalons. Lower the sympathetic hormones, the epinephrine, the cortisol levels. These are the things you need to do, and start eating more whole foods from the ground, not those processed things in those cans or those jars or those packages. Very, very important. And you'll get this. But remember, tinnitus is tricky. And I don't want you to be that sufferer, because I believe by utilizing these simple techniques, this can be a miraculous healer when it comes to diminishing your sound very quick. I hope that this video serves you well. Please share it with your friends and family. Leave your comments below. And most important, make it a great day. I'm Dr. Alan Mandel.